Hello, I'm Dr. Niamu. Welcome to the mobile clinic. With the mobile clinic, we bring the hospital close to you. The aim of the mobile clinics is to create an awareness on health related mistakes that people do when seeking for treatment. And today, I'm going to talk about fibroid. Some of the mistakes people do when seeking for treatment for fibroid. So, what is fibroid? Fibroid is a tumor or a mass that formed within the uterus. How common is it? Fibroid is a very common disease, and based on statistics, about 60% of women develop fibroid within their womb when they are approaching the ages of 30 years. I'm not trying to scare you. Please don't be worried. In most cases, fibroid doesn't cause any problem. It doesn't cause any problem at all in most cases. However, there are few cases when a doctor will become concerned when a client have fibroid. And usually there are a lot of women walking around who have fibroid, but they don't really know about it. That's how common it is. And how do we usually see this fibroid? Mostly they are seen incidentally when they come to the hospital with other complaints. Sometimes the client may come in with pregnancy, and we might do ultrasound, which will then see those fibroid around. We'll just advise them on it, but mostly treatment is just observations. We don't do any intervention. We become very concerned when the fibroid is causing problems. And some of the problems that are related with fibroids are sometimes they may be bleeding. They may have abnormal menstrual bleed. This may either be a heavy menstrual bleed, or sometimes bleeding in between menses. And one of the complications that may result in such a situation is anemia, and anemia causes a lot of problems. So in cases like this, we intervene and then remove that fibroid. Another case may be more of cosmetic related, where a client may come in with a distended abdomen, distended abdomen, where the client may look like someone who is 8 months pregnant. So in that cases like this, we also intervene and then remove the fibroid, so that the such female might have confidence or within herself, or feel freely when moving around. Another cases will be chronic pelvic pain, where the client might be complaining of a lot of pain around the pelvic area or the lower abdomen, which doesn't go away. So in such cases, if that pain is caused by fibroid, we then intervene and remove such fibroid. And in some cases too, some may come in with infertility. So in such case too, we try to intervene to remove the fibroid. And most of them, once the fibroid is removed, then they then gain their fertility back. So those are some of the few situations where someone may come in with fibroid, and we'll try and intervene. Aside that, we don't do anything. And there's a reason for that. So as we are going on, I will lay those reasons and it will make you understand. Also, now these are some of the now we are going to talk about some of the health mistakes that people do when they seek for fibroid treatment. A lot of people have this kind of belief that there are medications that can shrink fibroid. Please refrain from such belief. At the moment, with the advance of the medical world and with all the technologies we've not really come out with very good medical treatment for fibroid. Please don't get me wrong. There are medical treatments available, but they are not good. They are not good at all. And I'm going to explain the reason why they are not good. So, no doctor will even prescribe such medication for a client. One, um, one, the reason why such medications were even made is because within the medical world, we noticed that when when females enter into menopause and they have fibroid, we notice that their fibroid shrinks. So, with that, medications were then developed, and such medications will then initiate menopause in a woman. And once that menopause is initiated, then the fibroid begin to shrink. But listen to me, the question is, if you're a young woman and you want to know, if you're a young woman, you can talk to a woman who have entered into menopause, and then you understand the kind of distress they go through. Menopause is not a good feeling. It's not a good feeling. So for me to initiate that with a medication in a woman just to shrink fibroid is in medicine we try to weigh the benefit of the treatment. But in this case, it's like the side effect outweighs the benefit. Because as a woman, you need your female hormones to make you look beautiful. And when menopause comes, it means that you don't produce those hormones again. So it means that those medications will be working the same way. And for us to suppress so many things that helps a woman to live, it's like a woman to live like a woman, all for the sake of fibroid, it doesn't really seem fair. And listen, the most annoying aspect of it is that when you take those medicines, too, the moment you stop taking them, the fibroid will come back. The moment you stop taking them, the fibroid will come up. You start taking them, they shrink the fibroid. And depending on how many years you still keep taking those medications, you are fine. But the moment you stop taking the medication, the fibroids come back. So when you think about that, what is the gain? How can someone put himself into menopause stress for so many years, and yet the moment the person stops taking the medication, the fibroid comes back? So in this case, no doctor in his mind will recommend such treatment for a person. So the only treatment available for fibroid, as I'm talking to you now, is just only surgical treatment. So please don't be deceived. Don't allow anyone to deceive you that there's medicine that can shrink the fibroid. No, there's none. In the hospital, the ones we have, they are not good, so we don't even indicate them for any of our clients. So please don't fall for that. And if there's anybody out there who knows they have a designer medicine that can shrink fibroid without causing any side effects, or those side effects related with menopause, then they are in to become billionaires. So please don't fall for that. So what treatments are available for fibroid now? There are two surgical treatments, and the first one is myomectomy. And the myomectomy involves the removal of the fibroid within the womb, and in this case the womb is preserved. This kind of treatment is only reserved with people who wish to bear child in the future, or young females who wish to bear child in the future. They are the only ones who this treatment is reserved for. The disadvantage about this treatment is the chances of reoccurrence is very, very high. It's very high. and that usually depend on the individual. In some people it may be 6 months, in some people it may be 1 year, 2 years, or sometimes even 5 years. So reoccurrence is much more of an individual situation. So that is for the myomectomy. The other treatment is the hysterectomy. The hysterectomy actually serves as a cure, but with that one is the removal of the entire womb. So anyone who wishes to bear child in the future, that treatment is not indicated for that person. So this is for only people who wish not to bear children again. They are the only ones who this treatment is reserved for. So sometimes as a doctor, I try to bring myself, I try to put myself into the shoe of my patient or my client. And sometimes I feel the treatment for fibroid available, yeah, doesn't really look palatable. Like it's not something that may attract the client. So that's why sometimes I feel a lot of our client fall victim to these fraudulent activities where they then go in taking herbal medications or other medications and thinking they might help shrink their fibroid, because these two treatments available are not really enticing. So I understand, but I'm sorry, that is the only treatments that are available. As I'm talking to you now, that is the only best treatment available. So mostly when our clients come to the hospital, we try to analyze their situation very well until we know that the treatment available overweighs the benefit before we then initiate sharp treatment. If there's no benefit, we don't even start it at all. So please don't fall victim of people who tells you there are medications for the treatment of fibroid. As at now, there's no medications. The treatment is only surgery. If you like content like this, kindly subscribe or like. And if there's anything you wish you want me to talk about in the near future, please comment. Please comment. Okay. See you in the next video. Thank you for watching. See you in the next video. Bye.